And welcome back to Life Unrehearsed. My name is Matt Delvecchio, specializing in life transitions, downsizing in the senior living industry.
And I'm Corrie Sirota, clinical social worker and author of Someone Died, Now What?
Corrie, we are both very excited. We're starting a new segment on the second half of every Life Unrehearsed show. It's called Helping Mums and Dads, and it's kind of in keeping with our Life Unrehearsed themes. You know, life happens, and we get thrown some curveballs, don't we? And so we're going to be addressing some of the tough, unexpected issues faced by the sandwich generation. They're worried about their kids, but they're worried about their moms and dads. They may be worried about their grandparents. So we're going to have a whole bunch of subject matter experts discussing many of the challenges that families are facing.
Exactly. We're going to have experts. We're going to have testimonials of people that are living some of the everyday stuff, but that often poses tremendous challenges. So in keeping with that theme, Matt, what do we have coming up on our first segment of Helping Moms and Dads?
Well, you know, it's we're going to address one of the questions that I get very, very often. I have a power of attorney. I'm good. You know, we're all covered. Well, in fact, the power of attorney is one thing, but there's also something called a protection mandate. There's a lot of confusion. What's the difference between both of them? So we're going to be talking about that. And we're also going to be talking about potential risks and hazards in your own home. And so we invited Katie Fagen to bring some expert advice. And Katie has a master's degree in social work from McGill University. She worked 16 years at the CLSC in their home care department with a specialty in elder mistreatment. And she's currently working in private practice and is the co-owner of Senior Solutions Montreal. It's a private company she started 13 years ago that offers professional services that include social work, occupational therapy for people who are experiencing a loss of autonomy. Katie, we are so excited to have you as our first guest of Helping Mums and Dads. Welcome to Life Unrehearsed.
Thank you. I'm so happy to be here. This is great.
Well, we're happy to have you as well. And thank you for joining us. You bring a wealth of knowledge, Katie. And let's get right into it. I'd like to begin with something you do all the time, and it's related to home assessments. And so what do you look for when you're doing a home assessment?
So when we go in and evaluating people in their home, we would always be assessing for risk. So that's what we're looking for. We want to look at some of the different risk factors and then how they impact on a person's ability to manage in their home. So some of the things we'll specifically look at, we call them ADL, so those are called activities of daily living. So examples will be, feeding yourself, how someone's able to groom themselves, do their showers, and, manage their incontinence care. So we look at all that functioning. We also look at what we call instrumental activities of daily living. And so examples of that would be shopping for yourself, getting your laundry done, the cleaning around the home, how this person is managing, their medication. Are they able to do their own banking, using the telephone as an example, and also transportation, so getting from like A to B. And the main question when we're going in is we look at these tasks and we say, are they getting done by the person? And if not, is there someone else? If that's not happening, then we identify, okay, there's a risk, there's a red flag.
So you go in, you do this, you've been very clear about what some of the risks are related to what you're looking for. And I was going to ask you, but you answered it as well. I was going to ask you if it's not them, because you're not necessarily going to a home with just someone who's living on their own. There may be another person there that can help them with those challenges. But now we are you've recognized, you've identified and assessed that they can't do it on their own. So what are some of the solutions that help minimize these risks?
So what we would do is we'd always look to see the person's social network. And so that would include like their family, their friends, neighbors. So we would see if these people aren't able to manage it themselves, then is there someone else who could step in to compensate for the person's like losses in the areas that I had mentioned? So that would be like the first thing that we would look for.
So if they've got, so for example, give us one of the bigger risks that you actually see. I know I often hear about the washrooms and bathrooms. Is that one of the big risk factors you're seeing?
Definitely. So someone's ability to manage their personal hygiene. So we would evaluate that, and so it's something we absolutely see often, for sure.
And then you've got your social network, and okay, there may be children that are out of town or very busy in their day-to-day, and so your social network is obviously your first area of going. But what happens now if all of a sudden you don't have that family member or that neighbor or that friend that can help you on a day-to-day basis? What options are out there for families?
So, good question. If there's nobody who's able to step in, then we would look to private or public caregiving services, and as an example. So we would see there are private companies that you could hire that have caregivers who could come in and accomplish these tasks and help the client with them. So that's available through, there's a multitude of private companies or through your local CLSC. And they have social workers who would assess what the losses are, and then they would delegate, what services are needed and put in the appropriate care. So that's also an option through public. In addition, though, I also want to mention often like religious or community services could have volunteers that are able to help and have like good resources that could help these people.
That's a great alternative as well. I'm glad that you're raising that. We're talking with Katie Fagen. She is the co-owner of Senior Solutions Montreal, and we're trying to find some solutions to some risk factors. Do you ever get resistance from someone if you've identified that they are not capable of living at home? And how do you handle resistance from the person?
So I guess resistance it's a great question, and I think the main thing to look at is, are they able to understand the risks associated with their decisions? So people live with risk all the time, and if they are able to understand this as a possible consequence, then they can make choices. If they're not able to, and they're in imminent danger, then we might identify and work with them or the family to say, maybe we need to look into relocation, and living at home is not necessarily the answer at this point.
Yeah, so let's expand on that. You first started with your social network, and then you're trying to get some home care through the CLSC that, as you know, can be very challenging for families. It's there, but usually it's not enough hours. A lot of families will choose to go private as well. After all that, you're saying, okay, maybe we need to consider relocating and moving from home. So what do families have as options in terms of relocation?
So you can go the public route, which would be through your CLSC, through that network, or if somebody is hospitalized, they would, liaise with the CLSC to help in terms of finding the public options available. If not, there are companies as well that you can hire privately or come in privately to help you see what all the different options are available. And depending on your losses, depending on the needs, then they would help you identify the best place for you to go.
That's where you come in, right, Matt?
Yeah,
exactly.
I know a company or two that might be able to help.
That's right. No, you've been doing this a long time, and you've been doing it well. No question about it. Just curious, what are some solutions, maybe quick solutions that, I don't know if they're quick, for hygiene and showering, for example?
Okay, so we always want to see if we could empower the person to be as independent as possible. So for hygiene, we would look to adapt the bathroom to make it safe. So the best professional for that would be for sure an occupational therapist. And some of the recommendations that they would probably make would be, transfer benches, which would help facilitate safe shower transfers from the bathroom. They recommend bars or a telephone shower. Of course, it would be important. You want to minimize potential for falls, so having like a non-slip mat. So if the person is still unable to do this independently, these adaptations actually are really good for someone who's helping them. So it keeps them safe and the client safe as well.
You're listening to Life Unrehearsed with Matt and Corrie, and that's Katie Fagen talking about risk factors in the home as we age. And Katie, we could talk on and on about all these other risk factors. We do have to head out to traffic. And when we come back, though, Katie, we're going to shift gears. And something I hear very, very often about what is the difference between a power of attorney and protection mandates? Do I need both? Can I use just one of them?
Welcome back. You're listening to Life Unrehearsed. I'm Corrie Sirota along with Matt Del Vecchio, and we are talking to Katie Fagen, the co-owner of Senior Solutions Montreal. Well, we just reviewed a whole bunch of risk factors about what can happen in a home as we age. Again, keeping in line with our information and segment about helping moms and dads, we're now going to talk about a very confusing topic, and I know that Katie's going to help us out here. We're going to talk about the difference between protection mandates and power of attorney. So let's get right into that. Katie, what's a protection mandate?
So a protection mandate, it's actually an official document, and it's something that someone signs. But the important thing about a protection mandate is you sign it when you can clearly understand the consequences of your decision. So you would have all of your faculties at this point. So in this protection mandate, you're designating one or more people to look after your personal care and to manage finances in the event that one day you're no longer capable to make these decisions for yourself.
So, Katie, I'm glad you mentioned that, and this is where the confusion comes in, because very often I get, well, I have a power of attorney. I'm good to go. I don't need the protection mandate. So where does that come in? What's the difference between a POA and a protection mandate? Okay,
so good question, and it's definitely something that people confuse often. So a power of attorney is actually null and void when a person is no longer capable of making decisions for themselves. So the power of attorney would only stay valid if you're capable of revoking it and changing, making changes that you feel reflect your best interest. And then the mandate, the protection mandate, would then go into effect when you're found to be medically incapable in court. And in order for that to happen, it has to be something called homologation. So the mandate would be homologated, and then the representatives would be able to officially act.
Let's get very clear, though. Either both power of attorney and protection mandate require the assistance of a notary?
So what you could do when you draw a mandate, a protection mandate, you could do that in front of a notary, or you can also do that with a witness. The legal questions, specifics, obviously I'm not a notary or a lawyer. I'll leave that for them. But the power of attorney is something you can do like banking power of attorney, or you could do a general power of attorney, which gives you more access to helping somebody manage. But again, with the power of attorney, it's really important. You have to be able to be apt and understand. So if something changes and I've named person X and I change my mind, I'm apt, I'm competent, and I could say, you know what, that doesn't work for me anymore. So that would be the big difference.
Listening to Life Unrehearsed with Corrie and Matt, and that's the voice of Katie Fagen. She's talking to us about the, sensitive subject of powers of attorneys and protection mandate. And Katie, you're bringing up some good points. All the more reason, please go ahead. I can't tell you how many times in my world working with families and seniors, and I asked, do you have a power of attorney? Sometimes the answer is yes, sometimes the answer is no. Very often I hear, oh, well, I don't have a protection mandate. You can get both done even when they're doing the wills. You could put those clauses in there. So let's go through the process, Katie. All of a sudden, your loved one, your mom or your dad, let's say, is no longer apt, and you have the protection mandate in place. Sometimes we assume, okay, well, I have the protection mandate in place. But in fact, it actually has to go through the courts now, so decision-making powers are passed on to that person that was assigned to them. So what does that process look like, Katie?
Okay, and I really love that you brought up that point, because I hear that so much. Someone says, I have a mandate, I'm good to go, I can make all decisions. So definitely that is a common misconception. In order to have this legally done through court and have the incapacitated person officially declared medically incompetent, you'd need a lawyer or a notary, and they would sort of quarterback the process. They would then request a medical assessment, and that's done by a physician. So that would evaluate the person's abilities to make decisions around like their personal care and around their financial management or property. But in addition to the physician's assessment, you would also need, it's called a psychosocial assessment, and that is done by a social worker. So it does similarly to the physician, it assesses the person's capacity to make decisions in their, in the areas that I had mentioned, but it also goes on to evaluate the person that they named. And when we do this, we really want to make sure that whoever was named as the representative has the person's best interest in mind, and that they are compensating for all of the losses that we've identified. So that's really important.
So to make matters more complicated, as a social worker, I often hear I'm not that's not what I'm doing. I'm not doing the assessments, but I have a lot of colleagues that do them. There can be family members that contest the results of these assessments, correct?
Yes, for sure. You definitely can. And sometimes, that's the problem. But when somebody is apt and they're naming someone, the idea is you understand what you're doing. And you understand if I'm naming, my daughter, I feel I trust her. And that's really important when you do name someone in your mandate. So if a parent named one child over the next, then we have to assume, and unless we could prove otherwise, what the risks are or if there's any mistreatment, we do want to try to respect. It holds a lot of weight. So if a mandate is different, a protection mandate, because the person made a choice in naming someone, than, let's say, naming a private curatorship. Because in a private curatorship, it is representation, but a person had never designated anyone in particular.
Right.
So that's extra important to make sure that whoever is named really has the person's best interest in mind.
So important, Kate. It's Katie Fagen, co-owner of Senior Solutions Montreal, helping us navigate and talking about protection mandates, power of attorney. So just to summarize here, Katie, we've gone through the process. It has to go through the courts. I hear so often, you need this doctor's report. The notary needs that, also needs what we call a psychosocial assessment. If you try to go publicly, I've heard waiting times publicly could be even over a year to get a public social worker to do that. So many, many families try to go privately to get that psychosocial assessment. This is what you do as well. So is that true? It's long waiting lists in public, so you do have that option of going private to get that assessment done.
For sure, absolutely. It does. The CLSCs, the public system's really, really swamped. And so, when, of course, people can wait, but they do recommend if you want to get something done quicker, then, like anything, you have the option to go public or private. There are times when I screen cases and I say this has to be something followed by public, especially if I've identified any mistreatment or any areas, of concern for me. So sometimes it really is appropriate to be in public, but often people can go privately and be able to get it done much faster.
And just very quickly, once the notary then has that psychosocial assessment, they have the doctor's report declaring inapt, they put that through the courts. How long, I guess, would that normal process take? Are we talking a matter of a few months?
It would be a few months, of course, with COVID, from what I've heard from, notaries and the legal department. It has taken longer through the courts, depending, but it should be a few months. So with our process, once we would go in, or another social worker, I assume it would probably be about a few weeks if there's no wait lists. And then once it gets processed, it's still a few months, definitely, to get that actually stamped, and official.
Right.
Well, thank you so much, Katie. How do people find out more about your Senior Solutions Montreal?
So first of all, thank you guys so much for having me. This was a lot of fun. And if anyone is interested to know more, you could check out our website. So www.seniorsolutions with an S, Montreal.com. And you can contact us through there. We'll be happy to hear from you if you have any questions.
All right, great. Katie, thank you very much.